Discussions around mental health and burnout have been on the rise. It is an issue that needs to be spoken about. It is also an issue that high-profile figures have increasingly been vocal about. And why not? After all, being in a position of power can take a heavy toll. Have a look at the photographs of these leaders, and that heavy toll is clearly visible. From when they joined the office to when they left the chair, be it the leaders of the free world or the athletes at the top of their game, they all seem to be bearing the impact of stress that these roles come with. Our next report taking a closer look.
I know what this job takes, and I know that I no longer have enough in the tank to do it justice. It's that simple.
This is what New Zealand Prime Minister Jacinda Ardern said while announcing her shock resignation. The reasons behind her statement can be many. Some would call it a political decision. Some would say it was all about optics. Was stepping down citing burnout justified? Did she take the easy way out? These are all questions that are being asked. After all, her popularity had plummeted. The chances of winning the next election were slim. The public was less optimistic about her. But whatever the reason may be, she is not the first prominent personality to talk about the issue of burnout. World leaders do experience the pressures that come with the job. There are some who choose to take a back seat for health-related reasons. Former Japanese Prime Minister Shinzo Abe too left office due to a chronic disease. Although he suffered from ulcerative colitis, an inflammatory bowel disorder, since his teenage years, he decided to step down as he did not want his illness to get in the way of decision-making. Surely, healthy leaders can definitely lead better. And health comes first. And both Jacinda Ardern and Shinzo Abe took the decision to step down when they no longer felt fit to lead their country. And it's not just the politicians. Athletes too feel the sting of burnout and declining mental health. Here are some names. Michael Phelps, American swimmer, who won 23 Olympic gold medals. Virat Kohli, Indian cricketer, one of the modern greats of the game. Naomi Osaka, renowned tennis player. Simone Biles, American gymnast with 4 gold medals. These are just a few names who came out and spoke about how they felt due to mental exhaustion. How they struggled with anxiety and depression. How they felt vulnerable. And all of this while they were already being touted as the pioneers of their field. And these are important catalysts in the fight for mental health. It brings us to the next question. Is there enough discussion about the mental health and burnout of those in power? Is the world paying enough attention to their struggles? Or are they themselves talking about it as much as they should? Common people look up to their leaders and idols. They look at their behavior, closely follow their lives. When these well-known personalities take the decision to come out and talk about their own mental health issues, it does have an impact. If they spoke more about their burnout and held more discussions about these publicly, these discussions become even more normalized. The COVID-19 pandemic highlighted the need for protecting one's mental health. Discussions around which need to happen a lot more frequently and with a lot more openness. Bureau Report, WION, World is One.
WION now available in your country. Download the app now. Get all the news on the move.